A new report published by the Indian Express, which filed right to information request, shows that the number of deaths due to chronic obstructive pulmonary disease has increased 9 times in 2022-2023 compared to the previous 7 years. Remember, smoking and air pollution are the most common causes of COPD. In 2022-2023, there was the highest number of deaths recorded so far, 886. The number in the previous 7 years didn't cross 150. COPD is a common disease causing restricted airflow and breathing problems. Now, for years, we've had studies that have shown the clear-cut link between air pollution and fatalities. This report reinforces that data. A January 2022 report in the reputed journal Lancet says, and I quote, "Air pollution remains one of the biggest and most immediate environmental threats to human health, leading to millions of premature deaths each year and the loss of millions more in terms of healthy years of life." Specifically, pollution resulted in more than 23 lakh premature deaths in India in 2019, the highest in the world, 23 lakhs in India in 2019. Also in 2019, 9 million or 90 lakh people died around the world because of pollution. So not just air pollution, but all pollution. And this pollution, all of it, was responsible for every 6th death globally that year. What is pollution? Lancet defines it as contamination of air by fine particulate matter, PM2.5, we keep talking about that, ozone, oxides of sulfur and nitrogen, freshwater pollution, contamination of the ocean by mercury, nitrogen, phosphorus, plastic, and petroleum waste as well. Also poisoning of the land by lead, mercury, pesticides, industrial chemicals, electronic waste, and also radioactive waste. That's what this concern is all about. Joining us now to look at these concerns, Ankita Upadhyay. She's the special correspondent with the Indian Express who came out with the report on Delhi and the NCR. Dr. Vivek Nangia, Principal Director and Head of Pulmonology at Max Hospital. Dr. Anil Gupta, Board Member of the Central Pollution Control Board and the Delhi Pollution Control Committee. And Ronak Sutaria, Founder, Respira Living Sciences Private Limited. Ankita, it's interesting that you came across these statistics on the number of deaths in Delhi as a result, most likely, of air pollution. How did you get this data?
Okay, so every year there have been many studies that that are published across the world that conclude that long-term exposure to air pollution is associated with an increased risk of COPD, especially in those with high genetic risk and unfavorable lifestyles. Every year during the pollution season, we see the OPDs full of patients, people being diagnosed with COPD, and all patients' conditions getting worsened. Every year, doctors also talk about how health issues are arising due to pollution, where the major point of conversation is around COPD. So it's something which takes time to evolve and happens with the long-term exposure to pollution and smoking. The impact of pollution on us is very slow, and there are other studies also that have shown what it's doing to us. One study from AIMS also said that PM2.5 levels are increasing our blood sugar levels. So, considering all of this, I decided to file an RTI on what is happening, because the immediate and the direct impact it creates is on our lungs. COPD is a very common disease. Now this RTI of ours has shown that this is something we need to focus on. And it's not the COPD deaths that have spiked instantly in 2022 and 23, but it's better reporting that has started happening, and this shows why it's important to maintain our data.
Dr. Nangia, the numbers of 800 or just under 900 would in fact be just a fraction of the number of people who have died as a result of restricted airways or COPD in Delhi, right?
Yeah, absolutely. I would agree with you. This is actually an underestimation of the actual numbers, because so many deaths happen because of pneumonia happening in COPD patients, stroke happening in COPD patients, heart attacks happening in COPD patients. So you really can't attribute only about 900 deaths to COPD. The number of deaths would be much higher. The only thing is that what was the actual cause of death, or the final cause, would probably be a pneumonia, heart attack or something. So in them, COPD comes as a secondary diagnosis. One is that people dying of COPD with acute exacerbation lining up on the ventilator and then dying, and the other is dying of another complication that happens because of COPD. Therefore, this number would be much smaller. There's gross underreporting that we see in our country for some reason. And of course, we don't have national registry. But what we've seen is that COPD is becoming increasingly common in India now. And this is happening not only in the smokers, but also the non-smoking population. The number of non-smokers developing COPD is going up. So what are the various causes that can result in that? One is exposure to biomass fuel, which is not happening now, at least not in the urban context. In the rural context, yes, there would be some exposure to biomass. So in urban context, I think it boils down to ultimately the exposure to pollution that is resulting in this development of COPD and the numbers of COPD going up so significantly. And it's just not COPD that happens because of air pollution. There's a myriad of diseases that can happen right from cardiovascular to cerebrovascular, brain strokes, heart attacks, arrhythmias, cancers, and in fact, it can even affect a pregnant lady where the child could be prematurely born, premature deaths, you already mentioned that. And of course, poor development of children, mental retardation in children, and also poor growth and poor immune system, especially the related to the respiratory system, is extremely poor in children who are exposed to air pollution.
Sure. Ankita, I think one of the very important changes that we've now got as a result of data which is available over the last couple of years is the direct attribution of deaths to air pollution. As Dr. Nangia was mentioning, a few years back, you would have people die as a result of a heart attack, or you'd have people die as a result of a stroke, but the underlying cause was never clearly identified. On the basis of the numbers that you are reporting, on the basis of the numbers that Lancet and others have started reporting as well, have we moved to a stage where we can directly say that people are dying, are being killed because of air pollution?
So pollution has a very slow impact on our bodies. It's not something we can know in a year or two. It has a very long-term impact, and now we need to analyze the deaths that are happening especially during the pollution season, that why it's happening, and we need to study these deaths, and we need to, just like we do, we maintain a data on cancers. We have a central cancer registry. We need to compile data on COPD deaths, and we need to understand what is the reason behind that. So you cannot know in a year or two that this death is because of pollution. It has a very slow impact on our body, just like long-term pollution has a very slow impact. So we need to have more research on this. We need to analyze each and every death that happens.
Ronak Sutaria, it's lucky that we've got this number that Ankita is speaking about, because these details were more easily accessible during the time of COVID, because factors contributing to deaths were recorded, and the rest of the time it's not as easily available. Do you believe that, what we are talking about here is just a needle in the haystack when it comes to the number of deaths in our country, which have actually been happening across generations, 4 generations?
So Vishnu, yeah, thanks. And I would like to commend this RTI study, because for a long time the policymakers have been refuting the medical numbers which come from Lancet, because those are exposure studies based on inferred data. So from a credibility perspective, I think this RTI results definitely are more hard-hitting.
Yes.
Because they are undeniable. Though I would like to extend this and say that the COPD numbers of course are alarming, but we should put the numbers for the medication together, because the usage of nebulizers, the usage of the cough medicines, for kids at least, under 5, I know that in Bombay and Pune, cough medicines in January and February run out of stock in lots of pharmacies. So frankly, they're taking this a little further and tracking the kind of consumption of, heavy medications for cold, cough, running nose, of course, the more serious steroids, will reveal a much, much more darker picture. So from the medication perspective, this is a very good step in terms of at least releasing this kind of information. But I'll quickly highlight some CPCB numbers that we've been looking, and we have someone from
Yes.
the board there. We've been tracking the Delhi's PM 2.5, the carcinogenic levels, between January 22 and January 24. And it's unfortunate to report that there is a 30% deterioration in the Delhi's PM 2.5 numbers. There were 155 in January 22. We have hit 204 micrograms for the whole month. And I'll of course, the WHO standards are at 10. So we are looking at a 20 times, I'm sorry. PM10 has also worsened by around 30%. So this is when GRAP and NCAP are but efforts, I will not say that efforts are not being made, but the situation is grim, and I'm glad that at least Indian Express story is putting out irrefutable numbers. I would also want to see some more pharmacy,
Sure.
medical data being released around this problem.
You know, Dr. Gupta, you're a board member at the Central Pollution Control Board. There have been other studies which say that all of us living in the National Capital Region, perhaps outside the NCR as well, are losing 12 odd years of our lives as a result of inhaling what we are inhaling. Every single measure that is done to control air pollution in the NCR falls well short of any expectation. Be honest with us, sir. Is it at this stage a lost cause?
Vishnu, ji, you have rightly pointed out, I'm a board member in CPCB as well as in Delhi Pollution Control Committee. And sometimes I feel sorry that in spite of being in the board, in both the boards, we are not able to do much. But I will give you the reasons. Let me just, if you give me the time, let me give given the basis of this air pollution. You know, air quality index has 8 parameters: PM 2.5, PM 10, ozone, NOx, sulfur, carbon monoxide, and lead. See, if you see the air quality index, if you go deep into that, you will be surprised to note that for last several months and several years, maybe for 2-3 years, the 6 parameters remain in good conditions. You know, we say that if air quality index is from 0 to 50, it is good. It has a minimal impact. If it is 51 to 100, it is satisfactory, minor breathing discomfort. 101 to 200, moderate breathing discomfort. 201 to 300, poor breathing discomfort. 301 to 400, very pure respiratory illness.
Yes.
And 401 to 500, severely effect on the health. You know, I always say, see, we need to have the air quality index of less than 200 round the year. But, you know, even in these days, our AQI, even today, you will see it is nearly 200 in different locations in Delhi NCR. I tell you the reason. You know, the highest degree of all these 8 parameters is counted as the AQI. You will be surprised that 6 parameters are normally within our control. See, ozone, NOx, sulfur, carbon dioxide, lead, all these are roughly, you know, even today, if you see, the ozone, NOx is 3, sulfur is 10, carbon monoxide 5. That says that the industrial smoke pollution, the vehicular pollution, the exhaust, the vehicle recovery systems are within control.
Then what? Then what accounts for that? 200.
I'm just coming to that. See, the main culprit is PM 2.5 and 10, and you know, even today, PM 2.5 is in one place it is 160. And in another place is 200, and PM 10 is roughly 93, and one place 150. Now I tell you the reason. See, it is not the job of the pollution board. Pollution board is a regulator. I have been regularly knocking at the door of the government. See, the major factor for PM 2.5 and 10 is the dust pollution. You know, Delhi has a length of roughly 28,000 kilometers of roads. It has a wide area. As per the government record, 3,100 tons of CND waste, they just put it in the roads. They are not able to treat it. Everywhere you go, except some posh areas, you will find lot of
No,
dust.
we see it every morning when somebody from the municipality comes to clean the roads, and they just push it from one place to the other, and the rest goes up in the air. And we all breathe it.
Let me just complete one thing. You know, 56% of PM10 contribution is from this dust pollution.
Yes.
And another one, let me just complete. Another one is the stubble burning. That is normal in the winter season. And third one is natural. You know, pollution has 2 levels, anthropogenic or the natural. You know, luckily, the nature favors us. We don't see the dust storm quite often in Delhi NCR. Hardly you will see twice, thrice, or 4 times in dust storm. That means nature is favoring us. But because of our own civic problem, you go everywhere in NCR.
All right, so I get the
everywhere.
point you're saying, that civic problems need to be looked at very, very closely.
And you know,
Half a second, I just want to keep the ball rolling because I'm running short on time. Ankita, you know, your report brings out data on the NCR region, and that's so critical. But based on studies and the ability to monitor data much better now, it's not the NCR alone, it's the entire Indo-Gangetic plain. It stretches all the way to the south of the country, the east of the country. Again, what we are looking at in terms of data now, and the impact on our lungs is just a fraction of what it actually is. Perhaps you'll need many more RTIs to get even closer to what the real number is.
I feel this is just the tip of the iceberg, and because as per the RTI itself, not all healthcare facilities in Delhi are represented in this data, which was sourced from various private hospitals and autonomous bodies and public healthcare facilities. So this is just something which is a very minuscule picture. We need to dig more deeper into it and find out what's happening.
And Dr. Nangia, this is something which is a year-round problem. A lot of parents would be watching this program. These numbers aren't going away. Is there any advice that you can offer them?
So basically, I think we've reached a stage where we need to decide our outdoor activity based on the AQI levels. First you need to classify yourself whether you're into a healthy individual or you fall into the high risk category. The high risk or the most vulnerable group would be those in the extremes of ages, that is less than 5 years and more than 65 years in age. Those who have a chronic respiratory disease like COPD, asthma, interstitial lung disease, or those who have a chronic heart disease like heart attacks, those who have a cerebrovascular disease, CKD, CLD, all those kind of comorbidities when they become more prone to developing complications due to the air pollution outside. So what they have to see is that when the AQI level is more than 200, then the highly vulnerable group or this high-risk group should restrict their outdoor movements or at least avoid strenuous physical activities like walks, jogging, exercising outdoors, playing sports outdoors completely. While if it is more than 300, then any healthy individual also should avoid their strenuous physical activity outdoors. When it is above 400, then it becomes absolute emergency where everybody should actually be indoors.
Yes.
And it's not just the outdoor air pollution, but also the indoor air pollution, which is another set of discussion altogether, which needs to be kept in mind.
No, absolutely. I'd like to thank all of you very much for joining us and reminding us once again that the reason we talk about air pollution is ultimately because it results, in this case, in deaths. And that statistic, the numbers which the Express have come out with, which sort of backs a lot of the other data we've seen at a larger level, yet another indicator of how grim the situation actually is. Thank you all very much for being with us. We're out of time on Left, Right and Center. From all of us here, good night.